pelvic floor muscles and vaginal care. The pelvic floor muscles play a crucial role in urination, bowel movements, sexual activity, and dilation. Therefore, prior to surgery, you'll be taught how to control these muscles. A pelvic physiotherapist will guide you both before and after the procedure. The pubic bone is located at the front of the pelvis, the hips on both sides, and the tailbone at the back. The pelvic floor muscles are located at the bottom of the pelvis. There are two sphincter muscles, one around the anus and one around the urethra. During surgery, space is created within the sphincter surrounding the urethra to make room for the vaginal cavity just behind the urethra. As a result, the sphincter also surrounds the vaginal opening. The pelvic floor muscles can become too tense, narrowing the urethra, vaginal opening, and anus. This can be caused by stress, delaying urine and bowel movements for too long or too often, feelings of shame or negative emotions about the genital area, negative experiences related to this area. A tense pelvic floor can lead to pain, difficulties with urination and bowel movements, problems with dilation, problems with sexual activities. A relaxed pelvic floor helps with improved blood circulation, which promotes wound healing, easier dilation, better urination and easier bowel movement. Regardless of whether you've had a penile inversion vaginoplasty or an intestinal vaginoplasty, you'll have to dilate daily for the first year. This is done using a dilation set. For the first year, you must dilate twice a day for 30 minutes. If you have had a penile inversion vaginoplasty, dilation is necessary to maintain depth and width. After 1 year, you may reduce the frequency, but you'll never be able to stop completely. The required frequency of dilation varies per person, but most can reduce it to once or twice a week. If you've had an intestinal vaginoplasty, you must dilate to keep the connection between the intestine and skin flexible. Deep abdominal breathing can help you to relax before and during dilation. Stay mindful of your breathing while dilating and focus on relaxing the pelvic floor muscles. Inserting the dilator during inhalation often makes the process easier. A good sitting posture combined with a relaxed pelvic floor will help with urinating and result in smoother bowel movements. Tips for urination: take your time during each toilet visit. Sit upright and relaxed with a slightly arched lower back and feet on the ground. Relax your abdominal and pelvic floor muscles and try to urinate in one continuous flow without pushing. After urination, tilt your pelvis forward and backwards a few times to ensure complete emptying. Tips for bowel movements: follow the same advice as for urination, but sit with a slightly rounded lower back instead. If you feel the need to push, apply gentle counter pressure to the vagina and labia using a clean, dry washcloth to reduce the strain on the wounds. In the beginning, dilation can be challenging, but it is essential to maintain the depth and width of your vaginal canal. Try to keep this goal in mind. Here are some of the ways to make dilation easier. Maintain a positive mindset. You're doing this for a good final result. Create a calm, safe and warm environment. Empty your bladder and/or bowels beforehand to avoid discomfort during dilation. Collect all the supplies in advance, including lubrication. Take your time. Do not rush through the process. After surgery, proper vaginal hygiene is crucial. Clean the external part of the vagina using the shower. For the first few weeks, rinse the vaginal canal with a betadine solution. After that, rinse with tap water. Would you like more information about vaginoplasty surgery? Watch the other 3 animated videos.